Hi guys, my name is Alan Now, registered pharmacist. I am based out of New Jersey. I am a board member of the International Society of Cannabis Pharmacists. And for those of you who have never joined us previously, this is a monthly state series that we have. We go state to state interviewing pharmacists and just kind of their role in the medical marijuana program. As we all know, no state has identical medical marijuana programs. And it's always great getting insight into how different states operate, some of the procedures, product availability, qualifying conditions that we see. And this week or this month, we have Virginia. So with us, we have Farzana Kennedy, who are very appreciative to have here. She's been through the inception of the medical marijuana program in Virginia so far. She works for a company, Beyond Hello, and I'm sure she'll tell you all about it. Strong background in compounding pharmacy also. So I'm interested to see your take on how compounding pharmacists might be able to get involved in the cannabis industry. But thank you for joining us. If you want to ask questions, please feel free to use a chat. We'll answer all the questions at the end. Usually it's about a 20-minute presentation and more of a discussion type after. Small group, so feel free to ask as many questions as possible. All right, so Farzana, all yours.
Oh, thank you, Alan. Thank you so much for the opportunity to be here and share my experience and bring Virginia to the rest of the world. Virginia is a very unique, state, so there's a lot to talk about Virginia. So I'm super excited to be here and making sure that we understand what you just said. There's so many different programs out there, and Virginia happened to have a very unique one that I may have not run into in other states. So as Alan said, I'm Farzana Kennedy. I am right now, currently, I am employed by Delizzo LLC as a president and the PIC, and it's the dispensary called Beyond Hello. I also chair I just want to highlight like some of the things for the cannabis that I have been doing. I'm a chairperson for Virginia Pharmacists Association Academy of Medical Cannabis in Virginia. This one came in place in 2018. We put that together. We established some of our members, some of our goals, what we want to do, and mostly really focusing on education and providing CE credits and whatnot for our pharmacists and technicians and anyone really in terms of clinicians that are interested to participate. I also participate as a president of the Virginia Medical Cannabis Coalition, VMCC. It is a industry led organization, and our goal is to educate the public, the patients, work with our legislators, making the program better, working with the state, and so forth. So that's kind of where I come from. So it's a very unique state where there are just a ton of stuff to be done and looked at in Virginia. So I wanted to bring out, there's the outline of Virginia that I am going to talk about, but first thing I wanted to make a big distinction in how the whole program works. So basically Virginia has a program that is vertically integrated off of one whole facility. When the actual permits, licenses were, the RFA went out from Board of Pharmacy. Board of Pharmacy regulates us. They send out application and you could apply, and there were 5 of them, and there's 5 different areas. And so there's only 5 of us, and out of the 5, 4 of us is in operation currently, but it's all done by Board of Pharmacy. It's out of one space, so that has cultivation, manufacturing, extraction, all of that, plus your dispensary currently. So that's kind of the structure. If you can keep that in mind, then everything else will flow through how we work through it. As far as patient certification process in Virginia, it's pretty complicated. I'm not, I'm familiar with a couple other states, but Virginia has a process that requires few steps, and even in those steps, it's very, very tough sometimes for patients to navigate the steps. So we come in handy for education as far as holding hands and walking them through, like you need to go get your doctor's certificate first, and then you go into the board and you apply for this. And when they go there, it is a huge steps to follow. As far as registration and rules, these are the basic guidelines for patients and practitioners, and these are annually. So initial and annual is $50 for patients and practitioners, $25 for parent, guardian, agent. So we have parent, guardian, and then we also have agent. And agent can be defined as somebody that's other than your family member. It could be a family member. It could also be somebody other than a family member who registers with the board as an agent. So Virginia has a limitations of a supply more than like quantity limits. So limits is 90-day supply, and it's the part that really unique about that and that works really well right now is it allows pharmacists to be able to see a patient, provide a consultation, and recommend the product. So you are actually doing all of that. So when a patient goes to see a physician, we don't have any condition. It's all open. Basically, you can be, if the doctor or the, so it's MD, DO, PA, and nurse practitioner can be your providers. When they decide that you could benefit, if the patient can benefit from this program, basically they just certify that patient. At that point, they go to the board, they ask to be given a board registration, and then once they receive that, then that's when they come to the dispensary, receive their consultation, product counsel, go over the whole, drug interaction, all of that stuff, and then they receive their product. This is a requirement for the first time for every single new patient. So I think I'm getting ahead of myself here with the slides. Virginia doesn't have any other states allowing any other to reciprocate to Virginia with your board or your registration. Virginia does not have that, but Washington, D.C. does accept Virginia patients and medical patients. They're still crossing the border, so that's that's kind of federally illegal for that portion. But once they're in this state, they're safe. So as far as that goes, qualifying condition, again, we don't have any. Virginia allows for any qualifying condition, and practitioner can certify them as they think that they can receive cannabis treatments or products to help them alleviate any symptoms or diagnosis. So so we don't necessarily, when we are as pharmacists providing this service to the patients, we have to be very careful. Again, we as pharmacists cannot diagnose. So when we see that certifying piece of paper that they bring to us, the certification from the practitioners, it's really hard. It doesn't have any diagnosis. It doesn't tell us any condition. There's no healthcare information on there. So you practically just have this sheet that tells this patient has been given this by the physician. So it's really confusing. We have no communication from the practitioner to the pharmacist. So therefore, Board of Pharmacy requires us to collect all of history and medication and anything that we should know before we provide services to them. And we're required to have that documented and put into a record keeping for 3 years. All record keepings are for 3 years in Virginia. And we have to justify, as pharmacists, we have to justify that this product and this dose and this recommendation is really going to be helpful for the patient. So that's it. That's a little tricky for pharmacists because we have not been doing that in Virginia in any other setting. So pharmacists in Virginia, just last year, we got some prescribing, able to prescribe few things, but it's not in force yet. So the cannabis comes ahead of us. So some of, it's a learning process, but it's a great opportunity for pharmacists to get involved, get beyond just, receiving an order from a physician and doing it. This is where they're really applying their clinical backgrounds. So certifying providers, like I said, they can be MD, DO, NP, PA, and they must be registered with the Board of Pharmacy as medical cannabis providers. So they themselves have to be registered. And there is a patient in the Department of Health Professions. There is a patient, can go in and they can look up what doctors are in there, what kind of providers in there for patients to find them. And that process even sometimes is so difficult for patients to navigate. It's just a lot of things that you normally wouldn't have patient doing it the way that we have it in the States. Available products, it's we don't have any limits on available products. It has to be something that we can say these dosage forms are related to pharmaceuticals. So we can do capsules, tablets, tinctures, oil, topicals, and then they're letting us also do consumables, inhalations, which is vapes. As far as consumables goes, we're not doing anything related to adult use, but it's mostly soft chews. Another word would be gummies. It can be troches under the tongue, those type of things. And the biggest thing with this is, and it's very tricky when you're really, really making the product, is to come up with this particular regulation and meeting the regulation, come up with this dose and be able to stick to the regulation. So each dose, so if you think that one milliliter of a product, so if somebody's going to take an oil, for example, if it's ingestible, they could have 1 milliliter as a dose, and that milliliter of dose cannot have more than 10 milligrams of THC. And at that point, it must also have minimum of 5 milligrams of THCA or CBD. So they put the THC limit in there to safeguard the patient overdosing or making something so concentrated, or that, if somebody gets hold of it, that's not a patient, that there's not a ton of products in it. So that was the safeguard, was put in place by a physician, a politician that really brought this 10 milligram dose limit in Virginia. However, they do not limit how often. So if we think that frequency could be, twice a day, 3 times a day, then it's fine, as long as one dose equals 10 milligram or less THC. And currently we do not have flowers. So it is just an update. It is on our bill this year. There are a couple of bills floating around, and we are asking for flower to be permitted in Virginia, because we know from being in it that patients are obtaining flowers, and they are going across Washington, D.C. to obtain that. This does limit patient access when we don't have flower. So Virginia Medical Cannabis Program, tend to be quite, can be expensive, and it's not affordable. So patient access is not there if we don't have flowers. So that's something on the bill. So we'll see how that goes. We'll know it by end of the month or end of next month. All right, next slide. This is the program. So far, as of January 2021, we know that there's about 9,500 patients, and it's growing quite a bit as we move on to the program. As the program become more mature, all the processors are open, and availability of products are there. And number of providers is about 670 and growing. And this was when I did my research on just to see where we were. That was a couple of weeks ago. You can add another, at least 500 to 600 patients, another 200 doctors onto the list. So they are moving quite fast, not fast enough. We're expecting, to have 180,000 patient registers for the program this year. So we'll see how that goes. So far, like I mentioned this earlier, number of medical cannabis permit holders are one pending, a permit holder or pharmaceutical processor authorized to grow, manufacture, dispense within a single facility. Last year, we were able to obtain additional dispensaries through the legislative process. So each pharmaceutical processor is also authorized 5 additional dispensaries. And we call them, dispensaries or patient access point in each HSA. So that's health service area. And so there'll be there's going to be total of potential for 30 dispensaries in total by end of the year or sometime in first quarter for next year. So we're growing, and, Virginia population is, it's 8.24 million out there, and where I'm located, Northern Virginia, we have at least close to 2.4 million patients if we touch the boundaries of the other processors, because we're more convenient for them to travel to. So it's quite a bit of patient population. We're pretty dense. All right, let's talk about pharmacists' role. And I gave it quite a little bit of away at the beginning, but let's go back and review. And one thing that Virginia has, and I don't know how many states have that, maybe some of you can, when we get into the Q&A, maybe we can talk about this, but Virginia does require a pharmacist in charge, oversight of the whole vertically integrated facility. So a pharmacist that is going to be overseeing the whole facility, and this is really pertaining to the rules and regulation and making sure, and those rules and regulations are pretty deep. They go into, as a PIC, you're supposed to make sure all of your employees got the proper passing into the facilities. That means that they have done Virginia state police, checking, background checking. They have done drug check. They have done, they have their proper licenses, or they have met their either experience or their education in order to work in certain places. So it's pretty interesting. They require minimum of 2 years experience to work in cultivation, or you have to have some sort of a degree in horticulture or botany, something like that, that you could pass to be working alone. Otherwise, they were requiring a pharmacist to be on site on that space. And pharmacists must be on site during the hours of operation at all times. So your staff cannot come into the facility unless there's a pharmacist. Doesn't have to be pharmacist in charge, but a registered pharmacist is on site. One exception is which was done legislatively last year, was because we experienced a tremendous amount of issues with cultivation, because when you grow, you have so many different stages where nutrients needs to be replenished, or there's a light went out and somebody needs to come in, and as a PIC, I really don't want to come in and do those things. So we were able to pass where they allow that PIC can authorize this person who meets the requirements of the state to have come in when it's needed, off hours, and full access to just cultivation. And at that point, they're only allowed to cultivate. They cannot come in and do a paperwork or go some other areas and do some other things. So at that point, they're absolutely just cultivating. And then they cannot enter manufacturing, they cannot enter dispensary, they cannot undo any of the other alarm system, none of that stuff. So they're specifically given, this access so they can just come and take care of the plants. Okay, so let's see. Okay, and this next part is really just what we're doing in our dispensaries. Pharmacists must provide patient consultation, and during that time, we must take patient history, drug interaction, and then definitely choice of products. Those 3 things are very strict from Board of Pharmacy. They want to know that you have taken some history to make sure that if there's opioid uses or or any of the history of any other issues that might be contradicting with cannabis. And then we also have reporting on and monitoring of PMP. So Virginia, I'm not sure how the other states are doing, but the Board of Pharmacy provides some sort of a guideline on, they gave us a DEA, and this is kind of a made up DEA from Board of Pharmacy strictly, and we're able to upload all of our cannabis products into the PMP because each one of the products have NDC numbers. So that when your patient goes to CVS or another pharmacy and another retail or even hospital, and if they go into the PMP, they should be able to see that they are receiving medical cannabis products and what they are. If they're not familiar with it, they'll be able to see where they got it. As far as pharmacists, like requiring pharmacists to obtain a particular certificate or CE, they really vague on that. But however, they do say what kind of, how did you get ready to be able to provide this service? So automatically that requires you to obtain some training, some cannabis certificate and so on. So I'm not sure how the other processors are working with their staff, but in my company, we have certain learning module that the pharmacists and technicians are receiving before they start. So, I have gone through our substandard operating procedures and putting all these together. These are all on pharmacists in charge. So you have to make sure that each one of the employees in their designated role receive designated education before they touch or begin their actual work. It's pretty strict on that, and those rules are not changing right now. I think I'm almost done. Why am I done so early? I love to have a Q&A. That's how I can extract and get into more of the question, because it's such a different lined up of the policy and procedures and the layout of the facility. I would love to talk about it, if you have questions, but Board of Pharmacy is our governing body right now. And you can find a lot of information on there. It is as far as policy and procedure goes, it moves in such a fast way that Board of Pharmacy is just can't take a breather trying to change what just happened last legislation and then what's getting introduced now. So we have, I listed some of the resources that you can go in, or if you're talking to somebody, or if you happen to be from Virginia, you can go in and you can find. And then also I added, the processors. This is us, Delizzo. This is Dharma, which is southeast, and then you have Columbia Care, and then G-Leaf are the three others besides us, and then you have one that's pending, that's not in operation. So, questions?
Great. Thank you, Farzana. Very, very informative. Hearing about other medical programs and comparing it to, my home state, you can clearly see there are a lot of differences. So while people are typing away, I just have some preliminary questions for you. So first, you said there's no qualifying conditions to get into the program. Then why does the liability of collecting patient data fall on the pharmacist and not that prescribing physician or recommending physician?
So it also does fall into the him or her. So qualifying providers or providers that are providing certification, they definitely have to have collect data. Patient has to have a diagnosis for them. And for us, we have to justify, because we are recommending, so we have to justify, this is Board of Pharmacy regs, that this product or medical cannabis is helpful to alleviate the symptoms. So we can, in our record, I don't necessarily say a patient has, I could say, they told me that they have PTSD, but I then record the symptoms of PTSD. What are you having? Oh, I can't sleep through the night, or I have pain, or I have this and that. Are they, so I'm not diagnosing them with PTSD. I am more focused on their symptoms, so I can recommend products to alleviate the symptoms.
Gotcha. And a follow-up question to that, most of the questions that I receive or that are common in these discussions is about pharmacist liability. Are there any separate third-party insurances that will cover your practice working in a medical cannabis facility?
No. Simple answer is no. So in about for 2 years now, I've been searching for that in Virginia. So as pharmacists, some of us may be familiar with Pharmacist Mutual, right? And they provide like small businesses, umbrella insurance. And then I have had insurance for, I own a compounding pharmacy, so I have insurance for that. I have insurance for everything. And then I also have a personal liability insurance through them, private ones. If I ever get a lawsuit, civil lawsuit, that I can protect myself in this space. It's a very sensitive issue. So I did host a seminar, and that was, I think that was beginning of the last year. I'm sorry, over the summer last year. And there was, I invited mutual pharmacists to come in and talk to us about cannabis and liability coverage. And there is none right now. The reason for it is that each state, when you go into the insurances altogether, it's a nationwide. And because it's not a federally approved program, in order for them to do each state separately, it's very costly, extremely costly. And it's like, they're like, I don't know when we'll be done. By the time we're done, maybe, if I pick a couple of states and work on it, we might be done, even not done by the time it becomes federally approved. So they're just not going to put in that work at this point. So I'm interested to know if anybody knows anything. I would love to pick their brain about that, because pharmacists that are coming on board in Virginia has a lot of liability, because we are making the recommendations and we are monitoring the patients, and we don't have any coverage. And a lot of my colleagues don't inquire about this thing as a standard practice. So I don't know if anybody has any different information, but that's something that I try to have bring up and say, maybe we talk to the companies that we work for. Maybe they give us some sort of a comfort that they'll cover us if we did not, break our due diligence process. We have done all of our due diligence, and we still get a lawsuit, and that, at some point. So I'm not sure where we are with my other colleagues, but it's a very important issue if we're going to be continuing to do this same process.
Yeah, there was a pharmacist in Colorado. I think his name was Shane Carmichael. He has his own consulting business, and he had spoken briefly about that. So I'll put you in touch with him.
Oh, that's great.
Yeah, this is why we have these kind of groups, so that we can share resources.
Yeah.
Okay, so for clarification on the dispensing aspect, is your model similar to a pharmacy where every script that's going out has to be verified before it can be received by the patient?
Yes. So the process is kind of like your, exactly like a pharmacy. So basically, patient comes in, and the way that, because of the COVID-19, we started our process with appointments only, so that we can manage the patients. But now we just opened up for both, like they can walk in and come in, and patients are coming back for refills, over time. But we still have to manage that 6 feet and how many in the building, so forth. But basically, they come in, and we're supposed to take all of their three particular documents, and that's their registration form from the Board of Pharmacy, their certification by the healthcare professional or the providers, and a valid driver's license or some sort of a photo ID. So we're supposed to have that scanned into the system, and we need to be checking that. And if there's anything changes for subsequent refills as well. Once that process is done, then they come in. If it's a first-time patient, they'll come in and they'll have a few minutes with the pharmacist. If they're already a patient that's very familiar with the cannabis program or cannabis altogether, because DC, Maryland been up for a while, so a lot of our patients are going across. So they're very familiar with, some of our patients are very familiar with. And then there's some that are not, that you have to really go through. And this is when I see so many patients are so thankful that there is a clinician in this space, that they could feel comfortable. And these are your legitimate, like I have patients coming in wheelchairs. I have, 75-year-olds. I have people that cannot get up in the morning coming from, fibromyalgia, whatever their diagnosis were by their, practitioners. And these are like real patients that I'm so always have seen in my compounding pharmacy for different things, specialty stuff. So it's really, an eye opener that this program is for patients. This is really, people are seeking this type of alternative. And we have had some feedback. People are like, I stopped my oxycodone, or I'm like down to once a day now. Or even within a few weeks, we have seen people that are trying not to go on to any type of opioids if they can avoid it. So it's very refreshing, to have an option and for you to be able to be there and help them. It's very refreshing.
Yeah, I share a similar sentiment. When I came from the independent pharmacy world too, and I remember distinctly the first 6 months, I saw one of my patients from my old pharmacy, and he gave me a really confused look. It's the same kind of quality care that we're practicing. Community practice, all the counseling abilities, everything translates very easily into the medical cannabis community. So great. And speaking on your background, how does your time working in a compounding pharmacy translate to what you're doing currently?
It's so Virginia, the one thing that you have to know about manufacturing that I can tell you about Virginia, we're CGMP. So for me, owning a compounding pharmacy where I have done a high risk compounds, I follow very quality control. QA and QC is big in our industry in compounding, coming from regulated by Board of Pharmacy under the USP. It really is easy for me to grasp the manufacturing portion of it with the CGMP. So we are under, Chapter 21 CFR 111, which is dietary supplement. And I have to say, like, I don't know, for some reason I thrive in, I love policy and I love regulation and I love like having standards. And I think that it really fascinates me when I hear programs that don't have certain standards, and I'm like, how do you measure quality? How do you measure safety? How do you measure anything without certain things in place? That's what makes it unique, your product or your services to be better or superior in that case. I believe in standards, and I think that that stands out. And I think, like, as clinicians, it's hard for me to be able to not have something like that in place that I could speak highly of, that my confidence, in a product. So I bring a lot of that to the manufacturing. I work with manufacturing in terms of making sure that we follow all the guidelines, and our even starting with our design, starting with our product, starting with, hey, what's in it, when we tested, making sure all those things are in place. Virginia has a very strict regulation. We can't taste our products, right? You have to like count for every single drop that you extract, and then you make your product. So it's a tricky one, but it's not something that I say that is stop us from anything. So I really enjoy the standards. I think it makes it a higher quality, and for me to speak to patients with that type of sense brings confidence in patients and trust, and the safety. We can really talk about the safety of this product, because Virginia has quite a bit of regulation on third-party testing.
Yeah, I mean, you say you love regulation, but it must be surprising a lot of these cannabis industry standards that, and this is where the interstate variability comes into play too. What you may get in one state may not be the same quality as another state. So without federal guidance, it's very tough for any industry to be standardized. Can you touch a little bit on the NDC that you were referring to from the Board of Pharmacy? You're in a unique state where I haven't heard of any kind of medical programs teaming up directly with the Board of Pharmacy or having a Board of Pharmacy oversight. So I'm appreciative of that, but can you touch a little bit on that?
Sure, absolutely. So Board of Pharmacy, so there's only 4 of us that's in operation. So Board of Pharmacy, for example, given us set of like a starting NDC number for each one, so they know this is from Delitzo, which is my company, or this is from Columbia Care, that's the other company. And then it's basically a bunch of numbers, some letters, and we just go down the list. So every time, so the way that NDC numbers are assigned, so you go through your production, you go through your grow. So I can take you guys into a little bit of that, so we're growing. I believe it or not, I was able to participate in a transplant of almost 4,000 plants from seeds, and these are autoflowers, that we have done, and it's very interesting. Like as a pharmacist, I probably never thought I would do, a cultivation, but it was an eye opener. It's very physical labor job going up and down, and we have 3 tiers, we have 2 tiers rooms, we're growing, but you learn a lot from these other individuals that are coming. So I really appreciate that collaboration of different professionals in this space. But to get back to that, once cultivation is done, you definitely harvest, and you go ahead and go through your extraction process. You make your product. Because it's CGMP, we have a big program for the QA, quality assurance program. It's huge, so we can't miss any of the steps. We literally following every step. And CGMP that we have. So I'm not sure how many of you are familiar with the dietary supplement, but it's just a process. So you have to say that your process makes your product safe and the quality of the product. So it's really a process, and really following that process from one space to another, from oil to going into winterization to going into distillation, and then now you're going to formulate, and then you're going to package. All of that, just a process. So it's pretty neat. At that point, when it's all done, and I made all these chews, soft chews or gummies for another word. I'm going to make 9 milligram gummies with 5 milligram or 5 milligram at least of THCA or CBD. At that point, I will package, and I will have to have a third party test all of that out. Once that is done, once it's all packaged before, and then it goes to third party, at the same time, I will have to submit to the Board of Pharmacy with an NDC number, a registration, basically a product registration. And all of these job is really the PIC job. So Board of Pharmacy wants to use the PIC to communicate all of this stuff. So I'll be submitting a form with name that I chose that is within the guideline. They've given us some criteria. You follow that, an NDC number. And the unique part about cannabis, I think you guys know this already, that the lot number has to be, is looked out very more clearly than in pharmacy world. So we do a lot number is another assigned number, and all those is submitted to the Board of Pharmacy with the test results of the lab to say that it matches or within 10% minus or plus all of our products. And then it also gives your terpene profiles, your heavy metals, your toxins, all of that, results of all of that. So you submit, and then once they approve it, at that point you can now release the product from QC. It goes into the dispensary. At that point, it acts like we're right back to where you guys, if you are just doing dispensary, from there on, it just into the dispensary. Virginia requires that we also, in the dispensary, that we put in the whole direction, like just like you're filling an antibiotic, like, so pick a vape or gummies, and if we named it something, you have the name, concentration, and my recommendation was, half gummy, 3 to 4 times a day. You'll be writing that out. You're going to put the qualifying or the certified provider's name on it. You're going to put quantity on it, days of supply, all of that, along with NDC number and your lot number. So that's another label. You have manufacturer label. Now you have the dispensing label. So that just like a pharmacy.
Great.
Did that answer you? It's a very long answer.
Yeah,
sorry.
yeah, and I have a ton of follow-up questions, but I'm gonna let Jill take the lead for a minute. She said she has a couple of questions for you.
Sure, absolutely.
Hi, thanks. I know we could probably talk a lot, but forgive me, I came in just a little bit late. So if you covered this, that's okay. Maybe we can talk later. But how did this begin with the Board of Pharmacy involvement with the legislature, and what was the liaison like? And I'm in California, so we're trying to figure some things out. We have no control over anything.
Yeah, and I think we're about to lose our control. So, so I think so. In 2015, there was a letter from a teenager gone to a legislator about how she has to go to Colorado for epilepsy. So this was 2015 is when we started this, and believe it or not, I grew up with this program. I feel like I've been there for birth of this program. So I have a lot of passion and fascination with the program and how it developed over last, almost 6 years now. So 2015, this letter comes to a legislator from this young woman who suffers from intractable epilepsy. So that was the first thing that was first put in 2015. So in 2016, Board of Pharmacy it was decided that Board of Pharmacy would be navigating this program. Nobody wanted it. Nobody really cared for it. We never came up with a cannabis, commission or anything like that. It was not really well thought out. So Board of Pharmacy is like, why is this? So they inserted like all of our Board of Pharmacy regs along with compounding regs. That's how I got involved. And I'm like, what the heck? You can't do this with cannabis, So I sat through like meetings after meetings after meetings, participated with writing some of these regs, removing some of the, verbiage that really interfere with, you can't really do this for cannabis. But I am really for, like I said, I want some sort of a standards. I want some value in the product where I feel confident to dispense to my patients or even talk to my patients that I have some references. So being a compounder, that's like typical for us, but being a high-risk compounder, that's even like always like tip of my tongue, like, oh, what test did you do? And what were the results? And where's the Q&A? Where's all these things going? So, so we sat through a lot of things we went through. So I wish like I had this slide. I have this slide from another talk that I did recently that shows you that the timing of all of this, how these programs. I'll be more than happy to share that with you, Jill. But basically we just went from there, and then intractable epilepsy was thrown out. We added that it'll be for any condition that practitioners felt that was appropriate. A couple things for practitioner restriction is that they have to register as a practitioner provider for medical cannabis with the Board of Pharmacy, but they also have a limit of 600 patients per practitioner. Now they can ask the board for more, and if they think that there's no other opportunity, so it's in their discretion, right, to let them have more or not. So I just wanted to know that. But I love to talk politics.
Did the Board of Pharmacy write the bill, and then they had an advocate in the legislature help
No.
pass it? No.
Board of Pharmacy never writes bills. Yeah, they're a governing body, but
Yeah.
they have their own
They want-
agendas. Yeah, they'll carry some governors or agendas and so forth, but they normally will not write something like this. So it came from people. The Normal was very involved,
Okay.
and Normal here is pretty conservative. Normal, they are really, really, the director of Normal. I'm really, really good firsthand, relationship with her. She values the quality. So she'll always say, pharmaceutical processors, I know it's a little bit more expensive, but they're here. They have the best quality product. They're under a very strict regulation, and therefore I trust their product. So she will be open about that with anybody.
Okay. So I just have one more question and then I'll let other people go. But the oversight for the labs you were talking about is really tightly regulated. Who has that oversight? And are there labs, are they just small, like micro labs for Virginia, or is there Botanicor and Green Scientific and all of that? Are they like, how do they decide who's going to test these products?
Right. So that's it. That started pretty sketchy from us. The lab had literally, there were no regulation on labs. It was just only regulation board had from their side is here's the bunch of stuff. So we had about like 400 some things to test, first of all. And then we were able to convince board that this is never could happen. This is impossible. We'll never have a product ready for you. So then last year, we were able to adapt Oregon testing. They have a pretty decent venue and the program for the lab testing. We thought that put some of the labs be able to provide the service. So the labs here struggle for quite a bit. Only regulation the board put out for lab was that they needed to be registered by the Board of Pharmacy only for in terms of product count. So if they're receiving so much, what's happening? So diversion, pretty much. That was their concern, and they wanted to make sure these products are kept safely. They had a right room for it, those type of things, but they were not. So these labs has to be DEA license 1. So they have to have a DEA 1, and they have to have, after they get that, that's when they can apply for Board of Pharmacy. But here's the gap. Board of Pharmacy does not ever verify if they can do this test, if they can meet the requirements that's on there. That is something they don't even ask on their application. So we've been working with the lab. So there's a couple. It's a monopoly in terms of lab, because you don't have many to choose from. Mm-hmm.
Right. Okay. Thank you very much.
You're welcome.
Let's talk another time. I'll connect with you.
Absolutely.
Yeah, and to piggyback on that thought, speaking of regulation, I think lab testing, quality control measures, what you test for, should be standardized across the nation. That would build a lot of confidence and just kind of give a centralized norm of what's generally accepted. It doesn't have to be necessarily stringent, but if you have 50 states that are testing 50 different ways with 50 different methodologies, it's going to continue that way until someone just kind of says, hey, let's all follow suit and do it this way. So back to one of the main complexities of cannabis is the batch to batch variability. Environmentals play a huge role from temperature, humidity, light control. So when you refer to lot numbers for your products, are you referring to batch of plants?
Yes, so it's seed to sale tracking for us for all of that. So it's really a complicated process to cover right now, but I can give you a quick overview. So if we started with the plant, a seed, that seed does not have roots at that point. We just, in our system, which is a platform that we use, and companies, and Virginia doesn't require a particular platform. That's another thing. They have to learn all of these other platforms everybody's choosing. So whatever platform that we have will have the seeds appear somehow in our system. And we have these seeds, we will plant them. But if it's not an autoflower, the seeds are normally will be germinated. So you drop them into the water and they break open. You see that, they are in it for about 5 to 7 days the most. At that point, they get planted into the dirt or whatever cubes that you choose. At that point, if they make it out, they will become a plant. But if we are taking the plant and cutting it, so it goes from mother to clone to mother again until you get your canopy ready for actual transplant of a whole harvest from plant to flower. It gets a number, it gets a job number, then it'll have, and we also have RFID tag, that requirement, so it has to be. But the funny thing is, board doesn't own a scanner. So I can put all the RFID tags, for me to monitor and make sure that every plant, when they're at a plant, when we say this is a plant, they have to have an RFID tag, and they have to belong to either a batch or a job number. From that, we'll be tracking that. Once they get into the flower room, from the mother room, from the veg room, wherever they are, once we decide this is going to go into be flower, they're no longer going to be, any more clones, then we're going to let them grow in mother room. And then when they're ready to be transferred to flower room, that is a batch. It all depends. In my flower rooms, I could have up to 2,500 plants. And then if it's autoflower, it tend to be same strain. So it's kind of easy. But if you have 4 or 5 different strain, and then what are you going to do? You're going to have 4 or 5 different batches if you're going to be producing product and they're not combined. If the strains are not combined, if they're going to stay separate, they're each going to be a separate batches. But that goes into extraction. And if they're separately, so then they get a different number for their batch number that they're going to get. The batch number will be very different from what they have in cultivation. And then once they dry and go through their particle reduction and extraction to a actual clear oil, before 3-4 different steps before that, they will become, they'll have a lot number related to that. So they don't have NDC number until the finished product is come to form.
So it's like compounding with plants almost, where each plant has your own unique API.
But I can tell you, it is very complicated. Virginia requires every 7 days to do you have to do your, you have to take your inventory. And even though you have your inventory in your system, you have to have a physical inventory. That means 1, 2, 3, 4, 5, 6. I have 5,000 plants right now with 3,000 clones. I'm like, and my grower keep cutting plants and becoming, clones. At that point, clones are not plants. So it's very complicated process, but it's doable. It's like you learn it, and this is the part that I gain, like my knowledge that I would have not in any setting in pharmacy. And I think that manufacturing portion of it is I'm familiar with already. It's just a bigger batch, maybe a slightly different dosage forms we're doing, but I think that the cultivation is very interesting.
Great. And we'll wrap up with this last question about billing. I'm always curious. So now that you have an established NDC, what is the likelihood of a third-party carrier paying for medical cannabis?
Oh no. They don't even pay for real drugs made into compound. Are you kidding me? I mean, this is like, and another thing, like being in the industry of compounding, and they are denying my patient from any product that I compound from a fresh API. It's ridiculous. They're not, that is an FDA approved API I have. But once I compound, that compound is not FDA approved. And therefore they deny across the border, right? So cannabis, it's DA1, it's not federally legal. It's a lot of work to do. I'm very interested, but I'm also curious because I think industry lacks the audit portion of your insurance. So I think they don't understand what you and I understand when it comes to audit and taking your money back and slapping all that. That's a wake-up call for them when
Yeah.
it comes to that.
Great. Just wanted to pick your brain. So it looks like we're almost out of time. Does anyone have any last minute questions for Farzana? Okay, well, thank you so much for your time again. This session is going to be recorded, so if anyone needs to reference it again, it'll be on the ISCPH's YouTube channel in a couple weeks. And Farzana, you had your email in there, right?
I think so, yes. It's my personal email, so even if I ever disappear, that email will stay forever.
All right, perfect. Thank you guys so much.
Thank you, guys. Have a good night.